I'm Dr. Andrew Iraniha. I'm a robotic laparoscopic and general surgeon. So I completed my general surgery training at Harbor-UCLA and UCI Medical Center in California in year 2000. And since then, I have been practicing in Orange County mainly with minimally invasive surgery. So my interest and expertise is minimally invasive surgery, which includes robotic and laparoscopic surgery, and I have been in practice in Orange County for the last 15 years. Some of my patients ask me about what really hernia is and what are the signs and symptoms of presentation of the hernia. So the hernia is a defect in the abdominal wall, and it could be congenital or acquired, and sometimes patient has congenital defect or weakness of the abdominal wall, and then throughout their life with repetitive movements and heavy activities and exercise, they can present with bulge or on and off abdominal pain. So the signs and symptoms of hernia usually is associated with the straining, heavy activities, lifting, anything that increases the intra-abdominal pressure that can cause pushing the content of the abdomen through the defect of the abdominal wall. And then that usually presents with signs and symptoms of bulge in different locations of the abdominal wall, or it can present with pain and discomfort. In fact, majority of patients actually have no symptoms. They get presented by a physical examination by their primary physicians. But sometimes they can come in with the discomfort or bulge, or they can present with a complication of the hernia. The complication of the hernias are usually incarceration or strangulation of the hernia. So with any type of increased intra-abdominal pressure, the content of the abdomen can go through the defect and get caught in there, and that's called incarcerated hernia. And then when the circulation to that structure or organ compromises, then you develop a strangulated hernia, which is the emergency and needs to be treated as soon as possible. They also asked me about the indication for surgery. Essentially, the indication to do operation and fix the hernia is when you diagnose the hernia. And the reason for that is a lot of patients that have no symptoms of hernia, they can have a potential complications of incarceration or strangulation of the hernia. And those usually very hard to predict during their lifetime. So if the patient has no significant medical problems that prevent them to perform the operation, then we can offer them surgical repair of the hernia. Usually if it's in the groin region, we call them inguinal hernia, which is one of the most common type of hernia. And then it can be in the belly button, or called umbilical hernia. Or people can develop any type of hernia in the previous incisions after any type of abdominal surgery. Essentially, those abdominal surgeries or incision create a weakness of the abdominal wall. And then later, by repetitive movement and activities and exercise, they can develop an acquired hernia after any type of operation. Almost 10% of the patients after any type of abdominal wall hernia surgery, they can develop an abdominal wall hernia and present with a bulge, on and off pain, or the complication related to the incarceration of the hernia. Those hernias are called incisional hernia. Type of operation that we perform to fix the hernia are essentially categorized in open versus minimally invasive surgery. So in open operation, we open up the abdominal wall on the top of the hernia defect, and then reduce the structures that incarcerated into the hernia sac back into the abdomen, and then close the defects and place the plastic called mesh over the top of the muscle, or between the muscle or under the muscle, and to reinforce the repair. The concept of the repair is when you place that plastic, it generates a foreign body reaction, scar tissue formation, and then incorporate that plastic into the abdominal wall muscle. And that process takes around 6 weeks. So after the 6 weeks, that area is significantly strong to prevent the recurrence of the hernia. Now, we can perform this operation with the open technique by making a small incision on the top of the hernia and placing the mesh after closing the hernia on the top, or we can perform this operation with a minimally invasive surgery. 30 years ago, when minimally invasive surgery or laparoscopic operation introduced to surgical field, it was a significant revolution, and it really helped to decrease the pain and make the recovery faster and make the post-op recovery much easier for the patient. Since then, there has been significant changes in technology, and we have access to different special and different instruments to perform this operation much easier. However, laparoscopic surgery has some limitations. The instrumentations that we use in laparoscopic operations are very rigid, and especially in performing difficult tasks of surgical tasks, we have sometimes limitations and difficulty, especially performing hernia repair and intra-abdominal suturing has some limitations. So over the last 10 years that the robotic platform has introduced to surgical field, we have been able to use that platform to perform those difficult surgical tasks much easier. The difference with the robot and laparoscope is that the visualization is extremely superior. We have 2 cameras in the scope that gives us a 3-dimensional view, so it restores the 3-dimensional view for the surgeon when we operate, compared to the laparoscopic surgery, which we had to operate with a 2-dimensional view of the monitor, and that limited our vision, especially depth of vision. I have been operating over the last 15 years in Orange County, and the majority of my expertise and interest has been minimally invasive surgery. I have done more than thousands of procedures with laparoscopic technology. Over the last 3 years, I have adopted robotic surgery in my practice, and in my opinion, performing minimally invasive surgery with a robot allows me to perform the operation much easier and with more fine dissection, which translates into patients' outcome after the operation. So it essentially decreases the pain and discomfort and facilitates the recovery, and give them the opportunity to have a better quality of life after the operation. Laparoscopic surgery or minimally invasive surgery is performing the surgical procedures through the small incisions. We essentially make small incisions in the abdominal wall, insert a camera into the abdomen, which is connected to the video and monitor, and then insert other special instruments to perform the surgical tasks. And that's called laparoscopic or minimally invasive surgery. Well, the advantage of that is to eliminate the making a big incision in the abdominal wall, and that again translates to post-op recovery. It decreases the pain after the surgery, make the recovery faster, and it allows the patient to go back to work and their regular activity faster. And that has been a revolution in general surgery over the last 30 years. So robotic surgery also follows the same concept. It's creating a small incision, placing the camera and the special instruments into the abdomen through the small incisions and eliminating the large incision. So it has all of those benefits of laparoscopic surgery, including less pain and faster recovery and faster going back to work and hip activity. And the only difference is robotic surgery allows the surgeon to see better, improve and restore the depth of vision for the surgeons, and also gives them the wristed instrumentation, which make the surgery much easier, especially when it comes to the complex operations. Over the last 3 years, I have been performing the hernia operations with the robots, and we have done significant numbers of inguinal or ventral hernia repair with the robot, and had excellent outcome under my hands. Transition from laparoscopic surgery to robotic for someone with the expertise in minimal invasive surgery is not that difficult. Obviously, there are people that had less experience with the laparoscopic surgery, so the transition from open surgery to the minimal invasive surgery, especially robotic, is slightly different. Just based on my practice over the last 15 years, I have done close to thousands laparoscopic inguinal hernias and ventral hernias with the laparoscope. So 3 years ago, when I started transition to the robotic surgery, I found that under my hands, the procedure is much faster and easier, and I can perform the operation with more fine dissection, which again translates to patient's outcome. And since last 3 years, I completely switched from performing laparoscopic surgery for hernias to robotic operations. 30 years ago, when laparoscopic surgery introduced to surgical field, there was a revolution. It was incredible changes as far as the patient's outcome compared to the open conventional surgery. However, laparoscopic surgery has limitations, and we sort of stopped seeing improvements in surgical care over the last probably decade. However, introduction of robotic surgery, in my opinion, was another revolution for in general surgical field. To me, robotic surgery is not just a device that gives you a better visualization and wristed instrumentation, but also it's a platform that you can adapt and improve the surgical field in the future by introducing the imaging into the surgical, especially complex surgical procedures, performing the operations with having CT scan and MRI or ultrasound during the surgery, which can allows us to perform more complex operations easier. Robotic operations also can be used for performing other surgeries, including colon resections or gallbladder surgeries, that we can perform these surgeries, especially gallbladder surgeries as an outpatient in the surgery center. There is a new technique that we can remove the gallbladder with a single incision using the robotic platform by making small incisions in the umbilicus and placement of special instruments that connects the robot and performing the whole operations with one incision. Patients, they have a slightly less pain compared to the laparoscopic technique, and also faster recovery, and obviously cosmetically they have much less scar tissues after the operation. Why do I like my VIP? My VIP is a surgery center that I have been working with over the last 3 years. The staff is incredible. The place is very nice, clean. We have incredible state-of-art equipments, including the robot. And then, but one thing that stand out compared to other surgery centers, in my opinion, in the fact that we merge the humanity in patient care in this setting. It's not just about giving the patient the best and highest quality of care as far as the technology. It's also about bringing the compassion, care, and kindness, which we see that in MyVIP. Our goal and mission here is to take care of the patient, understands their fear and anxiety, and give them the comfort and take him through these stress of operation with kindness and compassion. And I've seen that in my patients after the surgery. They had significant and remarkable experience of their surgery. So the idea in this setting of MyVIP is to bring not only the highest quality of care, best and state-of-art technology, including robotic and laparoscopic surgery, but also look at the other side of the patient care, which include humanity, bringing the patient's compassion, care, and kindness to help them to go through this stress of operation. Because the surgery obviously is not fun. It's always associated with anxiety, stress, and bad experience. So all of the patients that they come to this center, they will be taken care of by the staff that are their attention is giving the patient best care with compassion and care. And that translates into post-op care, in my opinion. Patients that have an incredible experience when they go home and they feel more comfortable and improve their recovery time.